guess I could do both. I could be.
If you've been in my program, you know.
So, a nurse is caring for a client who has hemophilia. The client reports pain and swelling in a joint following an injury. Which of the following actions should the nurse take? Okay, welcome. Doing some med surge questions today. Focused on cardiovascular and hematology. All right, so the answer is A, prepare for replacement of the missing clotting factor. Hemophilia is a hereditary bleeding disorder in which blood clots slowly and abnormal bleeding occurs. It is caused by a deficiency in the most common clotting factor, factor 8, hemophilia A. Aggressive factor replacement is initiated to prevent hemarthrosis, which can result in a long-term loss of range of motion in repeatedly affected joints. All right. So the next one, a nurse is caring for a client who has a demand pacemaker inserted with a set rate of 72 beats a minute. Which of the following findings should the nurse expect? So you have A, telemetry monitoring showing QRS complexes occurring at a rate of 74 beats a minute with no pacing spikes. B, premature ventricular complexes at 12 beats a minute. C, telemetry monitoring showing pacing spikes with no QRS complexes. And D, hiccups. All right. The answer is A, telemetry monitoring showing QRS complex occurring at a rate of 74 beats a minute with no pacing spikes. The nurse should not expect pacer spikes when the client's pulse is greater than the set rate of 72 beats a minute because the client's intrinsic rate overrides the set rate of the pacemaker. Next one. A nurse is caring for a client who has severely elevated blood pressure. Which of the following findings should the nurse identify as a manifestation of hypertension? A, vertigo. B, epistaxis or epistaxis. C, exophthalmos. Or D, spondylolithiasis or listhesis. Oh, child. So put your answers in the chat. All right. Answer is epistaxis. If you didn't know, that is a nosebleed and it's a manifestation of elevated blood pressure. Hypertension is often asymptomatic, but when it's severely elevated, it can also cause headaches, dizziness, facial flushing, and fainting. All right, next one. A nurse is teaching a client who has iron deficiency anemia. The nurse should encourage the client to increase consumption of which of the following foods? A, beef liver, B, oranges, C, turnips, or D, whole milk. A, beef liver. The nurse should encourage the client to increase her consumption of iron rich foods, including meat, fish, and poultry. A 3-ounce serving of beef liver contains 4.17 milligrams of iron. Welcome in, welcome in. We're doing some med surg questions covering cardiovascular and hematology. If you don't know, it's fine. Just do your best at guessing. All right. A nurse is completing an assessment on a client. Which of the following findings should the nurse identify as a risk factor for coronary artery disease? A, hypothyroidism, B, hypertension, C, diabetes mellitus, D, hyperlipidemia, or E, tobacco smoking. And this is select all that apply. All right, just one second. Let me pause this real quick. So the correct answers are hypertension, diabetes, hyperlipidemia, and tobacco smoking. A client who has hypertension, diabetes mellitus, hyperlipidemia, or a history of smoke and tobacco is at risk for coronary artery disease. Hypertension and hyperlipidemia can be controlled by diet and exercise along with medication if needed. Diabetes can cause damage to large and small blood vessels, which leads to poor perfusion, cell death, and organ damage. Diabetes mellitus can be managed by monitoring glucose levels and implementing diet and exercise recommendations. Cholesterol levels, such as total HDL and LDL levels, should be monitored since elevated total serum cholesterol levels increase the risk of myocardial infarction. Finally, smoking accelerates the rate of the narrowing of the coronary arteries and increases the risk of clot formation. Smoking cessation classes or other forms of treatment can be offered to help the client quit smoking. All right. Next question. A nurse is teaching a 70-year-old client about risk factors for heart failure. The client has mild asthma, diabetes mellitus, and coronary artery disease. Which of the following statements by the client indicates an understanding of the teaching? So, first one is my diabetes will not increase my risk of heart failure. My asthma makes it more likely for me to have heart failure. My age does not increase my risk of heart failure. Or D, my coronary artery disease is a risk factor for heart failure. Mhm. All right. D, my coronary artery disease is a risk factor for heart failure. Coronary artery disease is a primary risk factor for the development of heart failure. Other risk factors include hypertension, cardiomyopathy, tobacco use, and family history, and hyperthyroidism. A nurse is teaching about a low cholesterol diet to a client who has a myocardial infarction. Which of the following meal selections by the client indicates an understanding of the teaching? A, chicken breast and corn on the cob. B, shrimp and rice. C, cheese omelet and turkey bacon. Or D, liver and onions. Answer is A, chicken breast and corn on the cob. The nurse should identify that chicken breast is low cholesterol and all vegetables, including corn, are cholesterol free. Therefore, this food selection by the client indicates an understanding of the teaching. Hey everyone. Welcome in. We're doing Surg, Cardiovascular, and Hematology questions. Mm, All right. Thank you for the follow. A nurse is providing discharge teaching to a client who had a sickle cell crisis. Which of the following statements indicates that the client understands the instructions? A, I should try to drink at least 2 liters of fluid per day. B, I can still fly out to visit my sister in Colorado for a while. C, physical activity is good for me, but I need to avoid overexertion. Or D, I can still go skiing during the cold winter months. So this is about sickle cell crisis. C, physical activity is good for me, but I need to avoid overexertion. So To help prevent a recurrence of sickle cell crisis, the client should avoid overexertion from especially strenuous activities. And the reason why the other ones are incorrect are listed below. Okay, so to prevent a reoccurrence of sickle cell, they need to drink at least 3 to 4 liters, not the 1 to 2 suggested. B was that to help prevent a reoccurrence of sickle cell, they should avoid traveling to high altitudes and in airplanes since passenger cabins are non-pressurized. And D, to help prevent a recurrence of sickle cell, the client should avoid recreational activities that require persistent exposure to cold weather. So we're going to stop there for the day. I'm definitely down to continue to come on every day and do questions little by little. And this is from the ATI. So thanks for joining me.